Welcome to True Health Tuesday, and the truth will set you free. Heart and lung health. Okay, so now this is going to be good because most everybody in here has one heart and two lungs. Now we're going to cover a lot of things, okay, and some things are kind of on the edge because if you're not aware of this, there is a bit of censorship going on. I love this quote from Benjamin Franklin. Being ignorant is not so much a shame as being unwilling to learn. Wow. How many times have you presented, hey, I have some information. I already know everything about it. Okay. Now, the censored stuff and the uncensored stuff are all going to be on the Dr. B VIP site. On this, if you're watching it on Facebook, if you're watching it on YouTube, please, please, please share, copy it, because this information is vital. And it's also very controversial. The second half, we can't even put on. We're self-censoring a lot. And all the members that are supporting Dr. BVIP, thank you, thank you, thank you. It's super appreciated. Figure a year ago, actually a year and a half ago, YouTube demonetized us. They've shadow banned us. They've done everything. And just like in the Matrix, we are still here. Yeah, I like that movie. Okay. So Extreme Health Academy, I just did a 2-hour, 45-minute webinar with them. I do that every 3 weeks, which it's so much fun. I got to talk to people in Australia, in Portugal, everywhere, literally all around the world. But these people have had health challenges and health solutions. And I'm there literally every 3 weeks. So let's get into this. Heart. Okay, now, no, it doesn't look like it does in Valentine. I know, I was upset at that too. Okay, the heart has 4 chambers. Okay, now the chambers, literally, the top part squeezes, then the bottom part fills up. The bottom part squeezes, and then the top part fills up. So you have this boom, 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 boom. And what you hear, like when your head's, listening to your sweetheart, or you're going into to listen to your kids and you hear that don't, it's literally the valves slapping together. Okay, now on the electrical part of the heart, the heart has 2 nerve supplies, and we're going to really get into that. You have one nerve supply coming from the base of the brain here, and that's the parasympathetic nerve supply. You have other nerve supplies coming from the top of the heart. They all synapse in the SA node, and the sinoatrial node is the pacemaker of the heart. And the part of this, knowing that you have parasympathetic and sympathetic nerve supply to the heart, the parasympathetic is like the diesel engine of the heart. This is the thing that always goes on. And the way I would explain it to the students when I was teaching, the SA node's the pacemaker of the heart. That has the parasympathetic and sympathetic nerve supply. Then it goes to the AV node. Okay, because that slows down the impulse, because you got to figure when the atrium are contracting, okay, bam, you got to wait a second, okay, so the ventricles fill up, okay, and then when the ventricles contract, the atrium got to wait a second, so the ventricles or the atrium fill up, okay, so you have that good rhythm, that good basic rhythm. Now, so it goes SA node, AV node, then a bundle of His, and then the Purkinje fibers, which go out to have the whole body working. Now, while this is here, we don't see the valves, but there's a 3-sided valve on the right, there's a 2-sided valve on the left. If you've ever heard of valve prolapse, like mitral valve prolapse, that's going to be the most common because that's the higher pressure side. Tricuspid is, very rarely hear that. But what happens is, and you can hear this on the heart, normally you're listening to lub-dub, 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 and lub-sh-dub, lub-sh-dub. That's a prolapse. It means the valve that functions like a parachute, so the blood comes up like this, it expands out and slaps together. Well, there's a ligament that connects that valve to the heart muscle. Now, if you've ever heard of scurvy, okay, scurvy was a nutrient deficiency disease from the Army, military guys, Navy guys. They would have it because they were eating salt, pork, and preserved foods. They didn't have fresh vegetables, so they were vitamin C deficient. Those ligaments connecting to it would develop in scurvy, so they would have cardiac arrhythmias. So a lot of cardiac arrhythmias could be from nutrient deficiencies. Okay, just know that because a lot of cardiologists don't really understand that, because they're not taught any kind of nutrition. Now, so the autonomic nervous system is everything. This is what controls your heart rate. You live your life through your nervous system. One part is sympathetic or fight or flight. The other part is rest, digest, and repair. So, and you're only alive, and this is one of the handouts that we have now. Okay, you're only alive, and you'll see optimal health has no symptoms. Death has no symptoms. And anything you do throughout life, if you take a step towards health, that's good. You take a step towards death, that's not good. So if you get that juice, the organic juice from apples or broccoli leaves, you're taking a step towards health. Okay, if you get the hot dog, okay, made of processed fats and animal and full of nitrates, you're taking a step towards death. And I know what you're thinking. Why not have the hot dog with the juice? Good, you'll be right smack dab in the middle. So just know that everything has to do with autonomic function. Now, in our crazy world, and this is kind of interesting, on the back of our handout, now this is by a comment from Bertram Russell, 1953. And I just got to read this because this goes on to what blood pressure is, because I'll ask people, what's a normal blood pressure? And they'll say, well, 120/80. Okay, good. Where'd you pull that out of? Scientific societies are as yet in their infancy. It's to be expected that advances in physiology and psychology will give governments much more control over individual mentality than they have even in totalitarian countries. Yeah, this is 50 years ago. Fitch laid it down that education should aim at destroying free will so that after pupils have left school, they should be incapable throughout the rest of their lives of thinking or acting otherwise than as their schoolmates would have wished. Diet, injections, and injunctions will combine from a very early age to produce the sort of character and the sort of beliefs that the authorities consider desirable. And any serious criticisms of the powers that be will become psychologically impossible. No, that is 2021 now. So let's look at what normal blood pressure is, because that heart kind of maintains it. Now, it's actually the heart initiates the pressure, but it doesn't maintain it throughout the whole body because your arteries constrict and dilate. The arteries have a muscular layer, so that's involved in it as well. Now, we can go way back to 1997. And back then, a Joint National Committee and their group of pharmaceutical reps, people who own hospitals, mucky mucks, big mucky mucks. And they said optimal for everyone should be 120/80. No, that was not Moses. Okay, Moses came down with other commandments. And they said hypertensive was 140/90. Now, where do they get this? Just sounded good. Okay, there's no real data on it. And so that worked until 2004. And then they thought, you know what? We really need to change this. So they had no data. So they dropped everybody's blood pressure down to 115/75 would be normal. Now the new pre-hypertensive was the old normal. Now, so what's the effect of giving Jordy? And this brought the number of people who were at high blood pressure, exponentially. So now this put a huge number of Americans on drugs that alter their physiology, that slowed, because do the blood pressure drugs, do they help oxygen in the tissue or do they slow it down? Do you just said slow it down, but I'm telling you, a lot of patients, when I say they'll slow it down, they'll say, well, I don't know, I'm not a doctor. God. Okay, so that was 2004. In 2014, slowing oxygen down to the brain can have a lot of damaging effects. It can actually increase stroke, it can increase dementia, it weakens immune system production, it causes more joint pain because the blood slows down to the joints. So then in 2014, they said the new normal, if you're under 60 years old, was 140/90. Okay, and the new normal, if you're over 60, is 150/90. So why would that? Of course, the American Journal of Cardiology broke from the pack or College of Cardiology, and they said it should be 130/80, even though we have no data for it. So, what's your normal blood pressure? There's not really consensus. Interesting that the University of Alabama, and this is 6 years ago, scientists found a risk of stroke went up by a third for each blood pressure medication you've taken. So if you're taking one, your risk of stroke is actually increasing. Do you know why? Okay, and if you're taking three blood pressure medications, it's 248% greater risk of stroke. Because think of this, your blood pressure has to be here. If you're dehydrated, it's up here. If you're hydrated, it's here. If you're running upstairs, it's here. If you're walking, it's here. If you're sleeping, it's here. If you're having a bad dream, it's here. So blood pressure goes up and down. And this is based on each individual. So every person in here, every animal on the planet regulates their blood pressure through their nervous system. So if they perceive stress, it's up here. They perceive relaxation. If your body's dehydrated and the blood's not efficient, then it's up here. So blood pressure changes. Now, if you take a chemical to alter that blood pressure, to lower it down here, guess what? The body is going to constrict the arteries like putting your thumb over a hose to get that blood pressure back up. Okay, does that make sense? That's why. So the blood looks like this. We have normal, acutely stressed, or chronically stressed blood. And this is super important that you understand the efficiency of the blood will directly correlate with what your blood pressure is doing. If you have chronic physical, chemical, or emotional stress, you're producing less stomach acid. So the blood cells start to get sticky. They start to clump together. And this could be nutrient deficiency, but it's generally called stress. The normal blood up there, you'll see red, beautiful cells that go through. They're fantastic. Acutely stressed, they start to get sticky and they start to clump together. But under chronically stressed, they really clump together. And it's also toxic environment because you have physical stress, chemical stress, and emotional stress. Now, you also have, you got your heart here, you got the aorta coming off of it, and then you got the carotid. Now, the carotid splits into internal and external. At that junction, there's a pressure sensor and a chemoreceptor. So your body is always utilizing blood to balance the pH or the acid-base balance of your blood. Because you got to have a very, very narrow range, 7.35 to 7.45. I mean, really, really narrow range. And so when you breathe out, you're breathing out an acid or carbon dioxide. So you've got these sensors. So if carbon dioxide goes up, then the pressure or the blood flow to the lungs has to increase so you get that carbon dioxide transfer. When carbon dioxide levels go too low, then the heart rate slows down so that the carbon dioxide goes back up. So in order to balance the pH, this is one of the mechanisms, not the only mechanism, one of the mechanisms that your body uses to balance it. So does that mean that if you have an alteration in those sensors, if you have a problem with the neck or a problem with the sensors communicating to the brain, that you're going to have an alteration in function? Yes or yes? Yeah, absolutely. Absolutely. And that's why also the Journal of Hypertension, now this was, 2007, they found out that one adjustment on that area cleared the nervous system's awareness of the environment. And that's what it really is. Because knowing that you have an automatic nervous system, if your nervous system is under a stress state or perceives the environment as a stress state, okay, it's like you and me, we're going to go on a roller coaster, okay? I'm scared to death of those damn things. Okay, you like go on it? Oh, okay, I'll pick somebody in here that likes it, okay? Okay, good, yeah, it would be a friggin' nightmare. Okay, you would look at the roller coaster with joy, your blood pressure would be here. I'm thinking about it, my blood pressure's going up. Skydiving, I'm okay with. Okay, scuba diving, totally cool, but a friggin' machine that flips around, hell no. Okay, no adverse effects were recorded, of course not. What a chiropractic adjustment does is takes pressure off the central nervous system, restoring normal function. We conclude that restoration of atlas alignment is associated with a marked and sustained reduction in blood pressure, similar to the use of two-drug combination therapy. Now, that's what the article stated in the data, but they should have put in there, unlike the two-drug therapy that would increase your risk of stroke 60%, a third by each drug. No, I know, isn't that weird? What's the side effect of a chiropractic adjustment? It's called health. It's good for you. So you got this, okay? CO2 levels go up, the blood vessels to the lungs open up, CO2 levels go down, they get constricted. So there's this balance there. Now, we got to look at lung function. So we're looking at blood health, heart health, and lung health. C3, C4, C5 keeps you alive because you have this nerve to this diaphragm. Okay? And when you breathe in, the diaphragm comes down, you breathe out, the diaphragm comes up, and that phrenic nerve comes out of the neck. So can you imagine if you've had a trauma? Could that alter part of the diaphragmatic function? Absolutely. And this is what we see. The lungs are amazing, amazing structures. Now, these babies, they're made of elastic tissue, so they want to collapse. And the ribs want to pop out. So in between this pleural cavity there's a little space. Okay, so there's always a little space. So when you breathe in, okay, the lungs fill up and the rib cage follows them. It moves out. So there's always a little negative pressure in there. This is why one of my we were taught by this cardiologist who's just brilliant. He said, so if you're buying drugs, you want to get shot in the gut, not the chest. And it was just, I mean, his analogies were crazy because if you break that pleural space, your lung can collapse. So that's a big deal. Just know that this is one of the reasons why we advocate diaphragmatic breathing. Because when you're breathing like this, where your chest is moving, you're only using the top third of the lungs, which is not a lot of surface area. When you're breathing correctly, the gut is moving out, and then the gut moves in. So it's hard, and I'm going to show you how to breathe diaphragmatically. Asthma is hugely common today, hugely common, and it's going to get worse because it's a disease of modern society, is kind of, and that's what the World Health Organization says. But the more bacteria that we're exposed to, the more pathogens, the more your body builds up. But also, if you're dehydrated, see, you've got these little alveoli at the end of the bronchus, and there's a lubricant in there called surfactant. And if you're fully hydrated, you're producing this surfactant. And the surfactant looks kind of like WD-40, clear, nice, works good. If you're dehydrated, you start producing mucus. And people with asthma have 10 times the amount of mucus of a person that doesn't have asthma. And so if you're dehydrated, you're not going to produce the surfactant, you're going to produce the asthma. But also you can see how the bronchus open up and close. What controls that? Smooth muscle. Where does the smooth muscle control from? Go on, say automatic nervous system. So when I say automatic nervous system or autonomic nervous system, you got to know when I get patients in that say, oh, I've had asthma for years. And I said, well, it's a smooth muscle control problem of the lungs. It has to do with the nervous system. We'll see if we can find the source factor in it. Okay? So you don't want to treat it with steroids, which weaken the immune system and stimulate the sympathetics. I mean, it's nuts. Then we look at this. A rural lifestyle is consistent with low prevalence of asthma. Exposure to farm animals, drinking unpasteurized or raw milk is protective against asthma. Why? Because, again, you're exposing your immune system to these certain pathogens. It's fantastic. And there's a thing called the hygiene hypothesis, which if you're ultimately clean all the time, like in hospitals, I think that, 125,000 people a year die in hospital-acquired infections? And so do you want your house as clean as a hospital? No, you don't. Okay, you want healthy bacteria, you want healthy animals, you want this exposure. Presence of pets in the house and large families are protective against asthma. These findings suggest an environment rich in microbial organism is beneficial in building infants' resistance to asthma. According to the World Health Organization, the search for environmental agents that protect against asthma is extremely important, holds the best chance for success for prevention and control of the disease in global context. So we don't need to be afraid of our environment, afraid of the viruses, afraid of the molds or funguses. Okay, strengthen your immune system. You're designed to live here. Does that make sense? Now, cleanliness makes sense, okay, where you're going to wash your hands after you poop. But if you're putting Purell on your vegetables and on your skin, which is toxic and poisonous, and you're spraying, Lysol everywhere or, some disinfectant, you're doing damage. You're really doing damage. Now, it's hugely important you get how oxygen is transferred, okay, at the alveoli. And these are little clusters of grapes everywhere. And the blood's got to get down to about one cell. It's about a capillary level. Now, the cells can fit in there in a chain, like, the Rouleau coin chain. But if there's a problem with the blood, now think of this. If you have stress, your blood cells start clumping together. And there's only three stressors. There's physical, chemical, and emotional stress. The blood can't pass through there, and it's got to do the oxygen transfer. So, and this guy, this was a canola farmer from Canada. So what's the glyphosate that he's spraying on there? Okay, it's a mineral chelator and antibiotic. So it's destroying the normal bacteria in his lungs, the normal bacteria in his gut. It's destroying all this stuff. And you need the bacteria and viruses and funguses, and you need the minerals. So you try and push those worms through that lung, guess what's going to happen? The blood pressure has to go up. Okay, think of it. Your blood is not efficient. You have to get more blood because it's not working as well as healthy blood. More blood to the lungs in order to get the carbon dioxide out, and it's not efficient at doing that. So you got to get more blood through to get the minimal efficiency. So what has to happen to blood pressure? It has to go up. It has to go up. I mean, that's his blood, it's still not healthy, okay? But at least the cells are separated. We had to do, and this is what you can do with standard toxicity or poisoning. You can do EDT chelation, you can do blood ozone, you could add nutrients, you can do a lot of stuff. Oh, look at this, Journal of the American Medical Association. Heart failure patients with higher blood pressure had lower death rates. Okay, now on the surface, you might say, oh my God, blasphemer. Okay, I thought everybody was supposed to have the same blood pressure. 48,000 heart failure patients seen at 259 US hospitals. Mortality rates were more than 4 times higher in those with a pressure of 120 in comparison to those who had pressure over 161. Why would that be? Are heart failure patients super healthy, or are heart failure patients, they got problems with the blood, lungs, and heart? Okay, so if you have toxic blood, lungs that aren't working right, heart that's not working right, guess what the body's adaptation is? It has to elevate blood pressure. Okay, and say, wow, that makes sense. Now, here's 2 methods for breathing. Okay, one, nasal diaphragmatic breathing. And this is the greatest way to learn. So put your hands on your tummy. We're going to do the bottom one first. Okay, now if I punch you in the stomach, okay, where's the air going to go? It's going to come out, right? Okay, and this is exactly how I teach my patient. I say, put your hand on your tummy. Okay, I'm going to punch you in your stomach. And they'll look, holy moly, this man's nuts. Okay, so when you get punched in the stomach, does the air go in and come out? You better say out because I'm going to punch you. Okay, so now on 3, you're going to push in your stomach and all the air is going to come out. Okay, ready? 1, 2, 3, push in. Now you're going to breathe in and push your tummy out. Now blow out and push in. Breathe in and push out. Blow out and push in. Breathe in and push out. And you'll notice I'm breathing in through the nose, out through the mouth. Okay, this way you're actually using the bottom 2/3 of your lungs. So you're using the whole lung surface area. And how many people in here feel dizzy? Okay, nobody. You've got to be good diaphragmatic breathers. Okay, what you're typically going to see if you're going to show this to your relatives, people are going to go, dude, that's a good high. Yeah, because they're not used to good oxygen. Conscious breathing is also excellent. You're breathing in, to the count of 8 would be fine. You hold it for about a count of 10 if you're an average with all the air in your lungs. Then you blow out twice as long as you breathe in. So you blow out at 16. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. Then you hold it with no air in your lungs for about 10 seconds and then breathe into a count of 8. And this is a great pattern for meditation because when you're meditating, your brain can start flipping around and looking at different ideas. So if you focus in on conscious breathing, it's absolutely excellent. Now, this was an article a few years ago, but it's pertinent, particularly for today, because how many people in here have heard the term "science is settled"? Okay, it never is. It never is. Okay, there's always a question about it. And you may have heard that salt can cause high blood pressure, or salt needs to be limited, or salt needs to be this. Okay, now we got a whole bunch of people with hyponatremia or low sodium that are dying from this. So the American Heart Association, um, their guidelines are 1.5 grams per day of sodium. Now, here's a study, and this study was amazing. Okay, you're talking 101,000 people in 17 countries. What they found out was at 4 to 6 grams per day. So you're talking, 3 to 4 times the amount of salt in the American Heart Association. They had lower death rates, lower heart problems, lower everything. Now, did the American Heart Association say, dude, we made a mistake, we just got to go back in there? No, because they would have to revise everything. They would have to revise everything. So it's more of a dynamic event. And I love Dr. Topol. The American Heart Association, however, isn't backing off on their 1.5 grams per day sodium guideline. I think there's a big lesson here about guidelines without adequate evidence. They can do harm. Hopefully, this list will be impactful, because it certainly has not been the case to date, as in cholesterol unanchored guidelines, blood pressure unanchored guidelines, PSA, prostate-specific antigen, mammography, and a very long list of poorly conceived non-anchored guidelines. Didn't you think that the doctor was telling you his stuff was based in science? Cholesterol-lowering drugs stimulate hardening of the arteries and heart failure. The aspirin a day, okay, is no longer recommended, and this goes back to 2013. But again, you're seeing a lot of medical professionals that are not changing their recommendations based on the science, because they're working in groups. They're trained by the pharmaceutical industry. Now, an aspirin a day, beautiful. Every 100,000 people take it, you might save 33 to 46 lives. Of course, you're going to lose 68 to 117 through gastrointestinal bleeding and 8 to 10 for stroke. Okay, that's not a good deal. And what's it supposed to do? Thin blood, right? I've got a blood thinner here that's actually non-toxic. It's yellow in color because it has a whole bunch of vitamin C in it, about 10 grams per day. Okay, so that's a good blood thinner. Oh, I'm sorry, I did flip back. Clear there is an incredibly fine balance between the possible benefits and risk of the intervention. We need to be extremely careful about over-promoting the aspirin intervention without fully understanding the side effects. American Heart Association. Based on the results of the study, experts said that the treatment of heart failure involving a multitude of drugs that proved to be ineffective should be eliminated as a treatment option. Wow, that's common sense. So do you see people saying, wow, we've initiated this intervention and we're not seeing good results? Okay, let's change our approach. Have you heard that? Yeah, occasionally. Um, Now, we can't say a lot of things, okay, on this. So I'm not going to, demonstrate or anything, but Voldemort was the name that should not be mentioned. Okay, so imagine if there was a medical procedure that was common. Okay, the brand new medical procedure. Okay, so we're going to look at a blood analysis, because we do blood analysis at our Huntington Beach office and Tijuana. I just want to show you. Now, this one is not normal. Okay, we're looking at target cells in there, which are mineral deficiency. We're looking at some inflammatory markers, but at least the red blood cells are separate. Okay, so I'm not going to put normal on this. It's just this is common for somebody who's got an acute stressor. Okay, does that make sense? It's not super healthy, but it doesn't look like this. Okay, this is the wizard that shall not be mentioned. And now you'll see lines in the back of this. Now that's fibrin formation. You'll see fibrin formation in somebody that's a mixed martial artist, or if the blood's used to be in responding to trauma, but you generally don't see it on the whole slide. And the red blood cells are completely stacked together. And that little white dot in there that's about the same size as a red blood cell, that should be about 3 times the size. That's a neutrophil. Okay? So let's say that you have blood that's not healthy, or you've been exposed to the name that should not be mentioned. Get that? Okay, good, just checking. Okay, let's go over how to get the blood healthy. Okay, so we know heart has two nerve supplies, lung has a nervous system that's got to be checked and cleared through C3, C4, C5, the upper cervical, insertion of the diaphragm. We know that all of this is important. Capsaicin, and this is one of the things I'm telling a lot of people to get on. Okay, but you cannot take, and because they have capsaicin pills, do not take this on an empty stomach. Okay, you got to take it with food, but for sure, talk to your naturopath, talk to your chiropractor, talk to your homeopath. If the medical doctor is interested in learning, which is most of them aren't, but if they are, say, hey, doc, what about this for keeping the blood healthy and separate? Now, we're looking at that it favorable effects on atherosclerosis, diabetes, obesity, cardiac hypertrophy, hypertension, and stroke risk. It has positive effect on that. Increases nitric oxide, serum nitric oxide levels, um, suggest that nitric oxide production within the coronary tree may be responsible for improved exercise tolerance as well. There's a great book called Left for Dead, okay, about a failed bypass surgery. And he used this stuff, and I did some research and found it's incredible. So, blood health protocols. Now, this is off of a handout for the Voldemort procedure. Nutrition. Okay, if you're concerned about blood that's clotting or that you've had to do a certain medical procedure, no sugar, little or no animal proteins. Why? Because it's hard to break the amino acids from the animals. No GMOs, no white flour, no toxic fats. Avoid gluten altogether. Those are just common sense for everybody. Pine needle tea protects against blood clots. Pine needle tea. Now, if you're pregnant, do some research on it. Talk to your midwife. Okay. The only research that I could find is that when cows eat pine needles and they're pregnant, they can have an abortion. So, when you're pregnant, look at this, talk to your healthcare professional, see if it's safe or not. Nattokinase. Now, this is just fermented Japanese soybeans, but can dissolve blood clots. Is that important? Yes or yes? Absolutely, particularly with what's going on. High dose vitamin C is a powerful antioxidant, and it directly renders viruses, bacteria, and toxins harmless. And again, I do 10 grams a day, and without any negative effects on the bowel. 10 to 12 is a good function. Magnesium. 80% of all metabolic functions require magnesium. Okay, so fantastic. 600, 1,000 a day. Glutathione. But again, all of these recommendations, talk to your naturopath, chiropractor, or homeopath, or whatever healthcare professional that you know that's skilled in nutrition. Glutathione, absolutely master detoxifier. NAC, okay, and N-acetylcysteine, precursor to glutathione. Again, all anti-inflammatory effects in the immune system, and it protects against lung damage and blood clots. Vitamin D3, should say D3 in there, fantastic, but you got to take D3 with K2, okay? And they work synergistically together. Oh, and this one says it. D should always be taken in conjunction with K2. Omega 3s, super important. Lower blood pressure, promote blood flow, help vascular walls. It's also a blood thinner, but it has to be from small fish, anchovy, mackerel, or sardine. Now, zinc and quercetin, these two work together fantastically well. There's certain protocols that we can't talk about for certain things that are going around here, but these two work in synergistically together. Zinc with quercetin, and quercetin, it's in apples, it's in a lot of things, but you can get it as a supplement. This is absolutely essential for healthy lung health. But, let's look at this. If you have altered structure, are you going to have an altered function? Could be, could be. So when we're presented, and we have people from all around the world, still do, okay, how they're getting in here, I mean, they're smuggling their bodies in through Canada, because that's now a prison camp. But I mean, they're making it in here, okay, which is amazing. Look at the structure first, okay? Look at the physical, chemical, and emotional stress, okay? And you'll find the solution, you'll find the problem, and the solution is really, really simple. This is why when we're talking about heart health, we're talking about lung health and blood health. Do you need to look at the nerve supply? Absolutely. Do you need to have regular exercise? Absolutely. Proper nutrition, and this means supplementation and whole food. You can't be eating poisons because your blood health is so linked to your overall health. And you're talking your brain burns 90% of the body's oxygen. If the blood isn't healthy, your brain's not going to be healthy. Sufficient rest. You need this to regenerate your tissue and prayer and meditation. Does that make sense? Now, for YouTube and Facebook, well, the next part of this is information that the Ministry of Truth that has demonetized us, shadow banned us, and deleted some of our videos. We're going into the realm of where we can talk freely. Okay, this is going to be on the Dr. B VIP, but here, before we go, hopefully that information we just presented was helpful. You never change things by fighting the existing reality. To change something, build a new model that makes the existing model obsolete. Buckminster Fuller. That's what we're going to be talking in the second half. We're going to be talking about what Alexander Solzhenitsyn talked about, building a parallel community, because you can't fight the tyranny that we're under right now. You just ignore it. Okay? You don't live along those lines. So I'll see you later.